We're going to address some of the questions that are frequently asked regarding home care aide certification and renewal process. So who needs to be certified as a home care aide? Well, it's any person who's hired on or after January 7th, 2012 as a long-term care worker for the elderly or persons with disabilities. Regardless of your employment title, you need to obtain the home care aide certification. This includes, but is not limited to, some of the following: an individual provider of home care services who is reimbursed by the state, a direct care employee of a home care agency, a provider of home care services to persons with developmental disabilities under Title 71A of the RCWs, a direct care worker in a state-licensed assisted living facility, a direct care worker in a state-licensed adult family home, a respite care provider who is reimbursed by the state or employed by a private agency or facility licensed by the state to provide personal care services, and any other direct care workers providing home or community-based services to the elderly or persons with developmental disabilities. A long-term care worker who meets the requirements in subsection 1 but is exempted under WAC 246-980-070 is not required to obtain certification. We will address these people later in this video. A non-exempt long-term care worker can provide care before receiving certification as a home care aide if they meet some of the following requirements. Before providing care, the long-term care worker must complete the training required by RCW 74.39A.074. Long-term care worker must submit an application for home care aide certification to the Department of Health within 14 days of hire. An application is considered to be submitted on the date it is postmarked, or for applications submitted in person or online, the date it is accepted by the department. A long-term care worker may not work for more than 200 calendar days from their date of hire without obtaining certification. To qualify for certification as a home care aide, you need to do the following. You need to successfully complete the entry-level training required by RCW 74.39A.074 before taking your exam. You need to successfully pass the home care aide certification examination and complete 4 clock hours of AIDS education as required in Chapter 246-12 of the WAC. This is included in the basic training requirements in the WAC 388-71-0906 and 388-112-0053. An applicant must also submit directly to the examination contractor. In this case, for Washington State, it will be the company Prometric. A completed application for examination provided by the examination contractor needs to be submitted with a fee required for the examination contractor. This will be the $115 for the written and skills test. An applicant must also submit to the department. In this case, it will be the Washington State Department of Health. You'll need to submit a completed application and certification on the forms provided by the department. You'll also need the required fee, which is $60, and a certificate of completion form from an approved training program indicating that the applicant has successfully completed the entry-level training required by RCW 74.39A.074. This is the 75-hour training certificate. And lastly, an applicant must submit to a state and federal background check as required by the RCW 74.39A.056. Now there are a few things to do when it comes to renewing your home care aide certification. 1. Certificates must be renewed every year by the home care aide's birthday, as provided in Chapter 246-12 of the WAC. You'll also need verification of 12 hours of continuing education hours as required by the RCW and WAC codes, and it must accompany the certification renewal. To reinstate an expired certification, if the certification has been expired for less than 3 years, the applicant must submit proof of 12 continuing education hours as required by the WAC and RCWs for each year it has been expired. If the certification has been expired for 3 years or more, the applicant must successfully repeat the training and examination process and meet the requirements of WAC 246-980-040 and the additional requirements of WAC 246-12. The following individuals are not required to obtain certification as a home care aide. However, if they choose to voluntarily become certified, they must successfully pass the entry-level training required by RCW and successfully complete the home care aide certification and examination and meet all the requirements of the WAC 246-980-080. These individuals would be one or more of the following: an individual provider caring only for a biological, step, or adoptive child or parent, an individual hired prior to July 1st, 2014 as an individual provider who provides 20 hours or less of care to one person in any calendar month. An individual provider hired after July 1st, 2014 will be required to complete the required training and obtain certification. An individual employed by a community residential service provider, an individual employed by a residential rehabilitation center licensed under Chapter 71A.20 of the RCW, or a facility certified under 42 CFR Part 483. This is the Code of Federal Regulations. Or a direct care employee who is not paid by the state or by a private agency or facility licensed by the state to provide personal care services. The following long-term care workers are not required to obtain certification as a home care aide. The training requirements under RCW 74.39A.074 are not required. These individuals would be one or more of the following: an individual who holds an active credential by the department as a registered nurse, a licensed practical nurse, or advanced registered nurse practitioner under Chapter 18.79 of the RCW, or a nursing assistant certified under Chapter 18.88A of the RCW. This would also include a home health aide who was employed by a Medicare certified home health agency within the year before being hired as a long-term care worker and has met the requirements of 42 CFR Part 484.36. A person who is in an approved training program for certified nursing assistant under Chapter 18.88A of the RCW, provided that the training program is completed within 120 calendar days of the date of hire and that the nursing assistant certified credential has been issued within 200 calendar days of the date of hire. An individual with special education training and an endorsement granted by the Superintendent of Public Instruction under RCW 28A.300.010. And lastly, an individual employed as a long-term care worker on January 6, 2012, or who was employed as a long-term care worker between January 1, 2011 and January 6, 2012, and has completed all of the training requirements in effect as of the date of hire. Although this exemption expires if the long-term care worker has not provided care for over 3 years. So how does an exempt person apply for home care aide certification? An individual exempt from certification under WAC 246-980-070 subsection 1 may apply for certification as a home care aide as follows. To qualify for certification as a home care aide, the applicant must successfully complete entry-level training as required by the RCW. They then need to successfully pass the home care aide certification examination and complete 4 clock hours of AIDS education as required by Chapter 246-12 of the WAC. This is included in the basic training requirements in WAC 388-71-0906 and 388-112-0053. An applicant must submit directly to the examination contractor. In the case of Washington State, this will be Prometric. A completed application for examination provided by the examination contractor, and a fee required for the examination contractor. This will be the $115 for the written and skills test. An application must submit to the department. Again, in this case of Washington State, it'll be Washington State Department of Health. A completed application for certification on the forms provided by the department need to be submitted, along with your required fee of $60, and a certificate of completion from an approved training program signed by a Department of Social Health Services approved instructor. This certificate must indicate that the applicant has successfully completed the entry-level training. This will be the 75-hour training certificate. And lastly, an applicant must submit to a state and federal background check as required by RCW 79.39A.056. A long-term care worker exempt from certification under WAC 246-980-070, subsection 2, may apply for certification as a home care aide as follows. To qualify for certification as a home care aide, the applicant must successfully complete the home care aide certification, examination, or test, and complete 4 clock hours of AIDS education as required by Chapter 246-12 of the WAC. This is included in the basic training requirements in WAC 388-71-0906 and 388-112-0053. An applicant must submit directly to the examination contractor and complete an application for examination and the fee required for the examination contractor. Again, in Washington State, this is prometric. The fee would be $115 for the written and skills examination. An applicant must also submit to the Department or the Department of Health a completed application for certification on the forms provided by the Department, and proof the individual qualifies for exemption under WAC 246-840-070, subsection 2, and the additional fee required, which is $60. And finally, an applicant must submit a state and federal background check as required by RCW. Someone who is an exempt home care aide can maintain or renew their certification, similar to those who are not exempt. To renew a home care aide certification, certificates must be renewed every year by the home care aide's birthday. Verification of 12 hours of continuing education is required by the RCW and WAC and must accompany the certification renewal. To reinstate a certification that has been expired for less than 3 years, the applicant must submit proof of 12 continuing education hours as required by RCW and WAC for each year it has been expired, and meet the requirements of Chapter 246-12 of the WAC. To reinstate a certification that has been expired for 3 years or more, a long-term care worker exempt from certification under WAC 246-980-070, subsection 1, must submit proof that the applicant has worked at least 8 hours as a long-term care worker within the last 3 years, and submit 12 hours of continuing education per year as required by RCW and WAC. Or successfully repeat the training and examination requirements and WAC 246-980-080, subsection 1. A long-term care worker exempt from certification under WAC 246-980-070, subsection 2, must submit proof that the applicant has worked at least 8 hours as a long-term care worker within the past 3 years, and submit 12 hours of continuing education per year as required by RCW and WAC. Or successfully repeat the certification examination requirements and WAC 246-980-080, subsection 2. When it comes to home care aides and continuing education units, a home care aide must demonstrate completion of 12 hours of continuing education per year as required by RCW. The required continuing education must be obtained during the period between renewals. Continuing education is subject to the provisions of Chapter 246-12 of the WAC. Verification of completion of the continuing education requirement is due upon renewal. If the first renewal period is less than a full year from the date of certification, no continuing education will be due for the first renewal period. The last section that we'll cover is home care aides and the ability to be nurse delegated. A home care aide certified may perform tasks delegated by a registered nurse for patients in community-based care settings or in-home care settings, each as defined by RCW 18.79.260. Before performing any delegated task, a home care aide certified must show the certificate of completion of the core delegation training from the Department of Social Health Services to the registered nurse delegator. A home care aide certified who is performing nurse delegation tasks must comply with all applicable requirements by the Nursing Care Quality Assurance Commission, as in WAC 246-840-910 through 970. A home care aide certified who may be performing insulin injections must show a certificate of completion of diabetic training from the Department of Social Health Services to the registered nurse delegator. A home care aide certified must meet any additional training requirements identified by the Department of Social Health Services. For the purpose of this section, delegated nursing care tasks must be performed, only on the specific patient for whom the tasks are delegated, only with the patient's consent, and in compliance with all applicable requirements in WAC 246-840-910 through 970. A home care aide certified may consent or refuse to consent to perform a delegated nursing care task. The home care aide certified is responsible for his or her own actions, with the decision to consent or refusal to consent, and the performance of the delegated nursing care task. A home care aide certified must not accept delegation of or perform the following nurse care tasks: administration or medication by injection, with the exception of insulin injections, sterile procedures, central line maintenance, or acts that require nursing judgment. A person who is working as a long-term care worker but has not received a home care aide certification must have either a nursing assistant certified or a nursing assistant registered credential and comply with WAC 246-841-405.